Dr. Emily Carter had spent most of her adult life inside hospital walls. The clean scent of antiseptic, the soft hum of monitors, and the rhythm of footsteps down long white corridors were more familiar to her than laughter, dates, or even friendship. Her dedication to medicine came from losing her mother at a young age to a rare heart condition. From that moment, Emily promised herself she'd become the kind of doctor who didn't give up on anyone. At 32, Emily was respected, calm, and endlessly professional. Her colleagues admired her, her patients trusted her, and her reputation as a compassionate yet brilliant cardiologist spread through the city of Seattle. Yet beneath that calm surface lived a loneliness she rarely admitted to herself. Everything changed one rainy afternoon in March. The emergency room was crowded when a young man was rushed in after a car accident. His name was Ryan Mitchell, a 34-year-old paramedic who'd swerved off the road while trying to avoid a collision. Emily was on call, and as the trauma team stabilized him, she noticed something different about this patient, not because of his injuries but because of the quiet strength in his eyes even through pain. "Stay with me, Ryan," Emily said as she adjusted his oxygen mask. He tried to smile through the fog of pain. "You're the one giving orders, huh? Guess I'm in good hands." Emily almost smiled back, almost. Doctors weren't supposed to blur lines, especially not emotional ones. But there was something about his courage that struck a chord in her heart. Ryan's injuries weren't life-threatening but serious enough to keep him in the hospital for several weeks. Emily checked on him often, at first out of duty, then out of something she didn't want to name. He was funny, humble, and had a way of making even the dull hospital days lighter. One evening, while Emily was reviewing his charts, Ryan said, "You look like you've been carrying the world on your shoulders, Doc." She laughed softly. "That's part of the job description. You ever let anyone help you carry it?" he asked. The question lingered longer than she expected. As the days passed, their conversations deepened, from medical recovery to personal stories. Ryan shared how he'd joined emergency services after losing a friend because help arrived too late. Emily opened up about her mother's illness, something she hadn't shared in years. They found connection in loss, in healing, and in their shared need to help others. By the third week, Ryan's condition improved. He began physical therapy and joked that Emily visited him more than necessary. She denied it, of course, but even the nurses noticed the warmth between them. It wasn't romantic in a forbidden way, it was a genuine, human connection. Then came the day Ryan was cleared for discharge. Emily signed the final papers with mixed emotions. "Guess this is it," Ryan said, holding the discharge file. "No more hospital food, no more checkups." Emily smiled. "That's what we want for our patients, a healthy recovery." Ryan paused. "And what about friendship? Do doctors ever stay friends with patients?" Emily hesitated. "Usually not. It's complicated." He nodded with a knowing look. "Well, complicated doesn't scare me." They exchanged numbers anyway, under the pretext of follow-up guidance. But what followed wasn't romantic in the traditional sense, it was gradual, respectful, and honest. They met for coffee weeks later, where Ryan arrived walking without crutches for the first time. They talked for hours about everything, their work, their fears, and the future. Ryan admired Emily's discipline, Emily admired his heart. There was no rush, no crossing of lines. They were two people who understood each other in ways words couldn't always explain. Over months, their friendship became the anchor in each other's lives. Emily found herself smiling more, laughing easily, and even leaving the hospital before midnight, something unheard of for her. Ryan brought warmth into her life, while she gave him a sense of purpose beyond his job. One day, during a community health event where they both volunteered, Ryan pulled her aside. "Emily, you've been the one who helped me heal more than any doctor ever could. Not just physically, emotionally too." She met his eyes, touched by his sincerity. "You've done the same for me." That day, as they stood under the soft glow of the evening sky, neither spoke of love, but it was there, unspoken and undeniable. Months later, Emily left her position at the hospital to join a new clinic focused on preventive care. Ryan supported her decision fully. Their friendship eventually evolved into a partnership, built on mutual respect, trust, and understanding. Years later, when Emily looked back, she realized the connection she once feared had become one of the most meaningful parts of her life. It wasn't an impulsive romance or a forbidden story. It was about finding hope when you least expect it, healing together, and learning that sometimes the heart heals not just through medicine but through kindness. Emily's story wasn't about breaking rules, It was about rediscovering what it meant to truly live, love, and trust again.